I'm Kelly Davis. I'm the owner of Skin Essentials Luxury Med Spa and Salon. I'm also an educator in lasers, CoolSculpting, and BTL, which is the Emsculpt Neo, Emcella, and Emtone. Today, let's talk about lasers though. I just want to educate you so that you know what you're looking for in laser treatments and what type of laser would be best for you and for your skin type. So I'm going to start right now with the Icon Cynosure Laser. What I love about the Icon is we get skin transformations where we can make people's skin look clear from red and brown, which would be pigmentation, spider veins, rosacea, and then we can also really help with acne scarring, stretch marks, and any deep lines, wrinkles. This machine does great results with minimal to no downtime at all. So some of you are probably wondering, what is a photofacial? So let's start there. A photofacial is a laser treatment that gets rid of red and brown. We use a handpiece that will do a pulse of light over your skin. And so basically the pulse of light searches down into the dermal layer to find any pigment, pulls it to the surface of the skin. So we will actually see it get darker the day of treatment. And then over the next couple of weeks, it will get a little bit darker and then it'll start flaking off. So after about 2 to 3 weeks, all that pigment that got pulled to the surface that looked darker than when you came in will slough off. It'll sometimes look like little coffee grinds and then it'll just go away. So instead of having age spots, freckles, or just larger pigmented lesions, it will help clear that. We also can clear blood vessels, cherry angiomas, and rosacea. So the way that the machine works for that, again, is the handpiece will go over your skin and the pulse of light will search for the little telangiectasia, which is your spider veins, and we do different settings so that we can pick the correct settings that will grab the vessels at the depth that they are. We even have great results with purple vessels, with thick, large vessels. We're able to look up different settings, and based on your skin type and the depth of the vessel, we're able to work around the machine and grab those vessels to where we can make them disappear on that treatment. So what we know about blood vessels is this machine will produce some heat. So heat is going to open up your capillaries. And so if we get the right setting, it's going to cause that blood to flow out. But then what we want you to do post-treatment is we want you to keep your skin cool with an ice pack, because we know that cold closes those capillaries back up. We don't want that blood flushing back into your capillaries. We have very successful treatments to get rid of rosacea, spider veins, and pigmented lesions to give your skin an overall clear complexion. The skin types that we will work on are skin types 1 through 4. So 1 through 4 is going to be your light Caucasian to your light Hispanic. Anything darker than that, it's going to be too dangerous to do the photofacial with. So we have to go to a different machine to be able to work on your pigmented lesions if you have a darker skin type than a light Hispanic. We also don't treat Asian skin types with the photofacial machine because Asian skin types have some yellowing underneath the skin, and sometimes that can cause hypopigmentation. Well, hypopigmentation is where it can actually cause whitening of the skin, and sometimes when that happens, you're not going to get the color back. So we're very safe in how we treat our patients, and the other thing that we always make sure with our patients with photofacials is that you, one, stay out of the sun. If you are in the sun a little bit, as long as you're wearing sunscreen and you're covering and protecting the area, we can definitely look at your skin and make sure that it's safe. 2, tanning beds are absolutely out. And then 3, we always have our patients get off of any kind of retinol or any kind of acid treatment that they're using on their face for anywhere from 10 days to 2 weeks, just to be on the safe side. There are certain medications that we will look at and just cause us to be a little bit more careful. Anything that are photosensitive medications like birth control pills or antibiotic, we still can treat you. We just are more aware of what the settings are. And then anybody who's been on Accutane, we wait at least 6 months. For the most part, other than that, we can treat you. However, we will go over consent and we will go over your medical history prior to treatment to make sure that you are a candidate for it. I hope this lets you know exactly what a photofacial does and what it's for.